Hi, my name is Dr. Sarah Della Torre. I'm a board-certified OBGYN and a fellow of the American College of Obstetricians and Gynecologists. I've been in private practice for over 12 years, and I've taken care of women in all stages of their lives. I speak with women every day about the changes their bodies go through with childbearing and age. Quite often, these changes adversely affect a woman's gynecologic health and wellness. I've seen the physical and the emotional distress caused by issues like stress incontinence or a lack of vaginal hydration. The symptoms of pelvic floor disorders can be embarrassing and painful and can affect a woman's self-confidence as well as her relationship with her partner. I'm encouraged by the results I've seen with Vsculpt, such as the ability to restore muscle tone, decrease bladder leakage, and improve lubrication. These are all essential in solving issues resulting from childbearing and age. Carrying a baby through pregnancy and going through childbirth, especially vaginal delivery, can negatively affect the pelvic floor. The muscles stretch and sometimes tear, which can lead to vaginal laxity and a decrease in pelvic floor tone and strength. Women complain of loss of bladder control, as well as a decrease in sexual function and enjoyment. During menopause, women experience a decrease in estrogen, which leads to less blood flow and thinning of the vaginal mucosal tissue. As a result, many postmenopausal women suffer from dryness, irritation, and pain during intercourse. I talk with women about practicing Kegels or doing Pilates before and during pregnancy and soon after delivery. However, muscle training can only do so much, and often women don't perform the exercises correctly or have adequate time to do them often. And of course, depending on the amount of trauma to the pelvic floor, these exercises may not help at all. Unlike many of the current medical treatments at my disposal, such as medications, which often have side effects, and surgery, which has its own associated risks, what I love about Vsculpt is that it's extremely easy to use, it's safe, and it can be done in the privacy of a woman's home. I held the role of principal investigator of a clinical study involving over 50 women, all of whom use Vsculpt every other day for 45 days. Our study results are beyond impressive. Over 90% of women experience a reduction in bladder leakage using both objective and subjective measurements. Specifically, women reported significant improvement in leakage caused by exercise, sneezing, or coughing. Over 80% of women felt improvement in their sexual function. In particular, women reported feeling more aroused, experiencing stronger orgasms, and feeling less guilt, inferiority, and embarrassment about their sexual issues. Finally, a remarkable 84% were satisfied with their treatment program and wished to continue using Vsculpt after our clinical trial concluded. As an advocate of women's health, I'm attracted to Vsculpt as a treatment option because not only is it helping the physical issues, it's also provoking an open, supportive dialogue amongst women about these very common pelvic floor issues, which up until now have been mainly kept quiet. Vsculpt is advancing women's health, and nothing makes me happier than making a positive impact on women's lives.